Hey guys, it's me. I promised that I would film the rest of the surgery video and the book, so this is me doing it. The video quality is probably pretty different because I'm on my iPad because I thought that would be easier in showing you the book. So we're just gonna roll with it. Okay, so the first couple of days in the hospital after surgery were kind of painful. I think I talked about it a little bit in my post-op video, but I have a really hard time taking pain medication. I don't like it. I don't like the way it makes me feel, and my body doesn't love it. And so basically I wasn't using my pain pump as much as I should because I would use my pain pump and then I would fall asleep and then I would wake up and be behind on liquids and then I would get stressed out. So I tried to get off pain medication as quickly as possible. And then there was a concern that I wasn't going to home because I wasn't drinking enough. And I kind of freaked out a little bit because IVs are really terrible for me and I really hate them. And I thought I was never going home. But once we figured out that I could go home and they took out my IV, it was way better. And then when I got home, just being home in my own bed and in clothes, and having my heating pad and stuff was amazing. So once I got home, it was pretty smooth sailing. Sorry, this is really weird. And my bed is nice. And I say a lot. So the big things with being home since that I've struggled with, my vitamins haven't been a big deal. I think I've missed like 2 or 3 over the course of the last practically month. And I don't know if it's because my vitamins work for me and I can tolerate them, or if it's because I view my vitamins the same way a diabetic should be viewing insulin. Like, I don't look at it as a nice thing to take or a recommendation. I look at it as something that I need to stay alive, and that if I don't take them, I will get really sick and my body will kind of shut down. So I do try to take them. It was actually one of the only things I had an alarm on my phone. Eating and drinking, that's been a really big struggle. I thought that I knew that I wasn't eating often enough because sometimes I would go like 6 or 7 hours without eating and I just wouldn't think about it. Like, I was playing Pokemon Go with my friends the other day and I had breakfast at 9 o'clock. And then 1:30 hit and I'm like, holy crap, I haven't eaten. This is bad. And so we made a pit stop at Taco Bell and I got a side of refried beans and I ate. So there's a couple of things that I've done to kind of tackle that. One is that I set alarms on my phone, which I'm a little cranky about, but whatever. But I set alarms every 2 hours that say eat. And hopefully that'll get me to just remember it more often. I also have a tiny cooler bag that I keep in my purse that has a couple of baby spoons in it, a baby fork, a packet of protein hot chocolate, a couple of pouches. So one is a fruit pouch, like a baby food fruit pouch, and the other one is a fruit-based protein pouch that my friend Mary gave me tonight. So hopefully that'll be good because it's like 13 grams of protein. And I usually tuck in a snack or two. So like I went to a Friendsmith's last Friday and it had chili in it and it had like a coffee ricotta protein pudding I made. Or like tonight, I knew that I was going to hang out with my friends while I had pie. I had half of a cup of tomato soup. But it had the rest of the salmon tartare that I made that I couldn't finish this morning. And it had a protein shake in it. So I always have food somewhere, sometime, somehow, and no excuse not to eat it. I also keep my vitamins or some of my vitamins in my purse. So I usually have a 2 to 3 day supply of vitamins at all times, just in case I get stuck somewhere. I have those, but also like if I'm on the move and it's time to take my vitamins, if I wait till I get home, I'm either going to be super behind or I'm not going to remember. And the alarm for my vitamins is separated by either 2 or 3 hours. I don't remember. So those are the big things. I still can't tolerate water. So iced tea is kind of a touch and go. Regular tea is a touch and go. Decaf coffee is usually okay, but sometimes not. But I can't tolerate water with even like Crystal Light or packets in it or whatever. So when I go out places, it's sometimes really hard for me to get stuff to drink because I can't just order water. So when I go to bars with my friends, and I wasn't a big drinker before, but I'll basically get a virgin Bloody Mary and I'll have them take out the ice. And so that way I'm just kind of sipping like flavored tomato juice essentially. But it's like one of the only things in a bar that I can drink that won't make me sick. Or when I go, we have a local hockey team here. It's like not an NHL team. It's like a pseudo farm team. But anyways, the only thing in the entire arena that I can drink is there's one vendor that sells vitamin water zero. It's not even a flavor I like, but I get it because it's the one thing I can drink. And because I do have basically a medical condition that makes me be really particular, I can sometimes bring in food and beverages. It probably doesn't hurt that my friend is the box office manager, but yeah, so that's what I do. So I'm like a super planner, and one of the things I've been working on over the last year and a half is to be able to let go and be more spontaneous. And because of gastric bypass, I kind of have to go back to super planning behavior. So hopefully I don't get like insane. Tacking on back to the why I don't weigh myself a lot. I'm really hoping that being prepared will make it so I can be more spontaneous instead of focusing on, holy crap, I have to be prepared all the time. It's kind of like when people find out that I can't tolerate sugar, and I'm just assuming I can't because I'm not willing to try it yet to find out if I can or can't. I don't want to get sick. But when people find out I can't theoretically have sugar, or I haven't had bread in 2 months, or I probably will never have a chicken finger again, and those are like my holy crap, the world is ending and I feel like crap food. When they apologize or they say they feel bad or they can't imagine, I'm like, I did this to myself. Like, yes, I did this for health reasons. This is an elective surgery. Nobody told me I had to get it. It was no one's idea. I've never had a doctor bring it up to me. I have brought it up with multiple doctors over the last 3 or 4 years. I asked to do this. So, like, yes, there's a lot of crap that I have to do and be conscious of and be aware of. And I'm going to spend the rest of my life living it kind of differently because I'm a bariatric patient. And I might lose my hair and I might not lose my hair. And all of these things could go on. But, like, I chose this. So, like, don't apologize to me because, like, this was my choice. And part of being a grown-up and making your own choices is not only living with those choices, but doing everything you can in your power to be successful with them. So, like, yes, would it be nice to lose a bunch of weight super easily and be able to do all the things? Kind of. Like, that's a nice side effect, even though I don't mind being the size I am. If I don't lose 100, 150 pounds, does that mean that I wasn't successful or that my life is over or that my surgery didn't work? Absolutely not. Not even a little bit. Anyways, so I've babbled a lot about this so far. So let's go to the book. I'm going to turn the camera around, and I'm really sorry if this is shaky because I have no idea what I'm doing. But we'll get through it together. Okay. Maybe. Okay, so here is my book. So every bariatric patient gets this binder, and it literally has all the things. So this is what my provider, my surgeon, or my surgical group, because there's 3 surgeons, I think, in my surgical group. This is basically what this looks like. So there's the table of contents, and then goes into like nutrition and exercise, and the exercise is kind of... So one of the things I like as we get to the exercise is that it breaks down everything. So like I was a dietetics major in college. So a lot of the stuff I knew about bariatric surgery, I knew as a provider. I think it's awesome that my surgeon gives not only a breakdown of what all of this means, but also provides resources so that anybody can understand it and be successful and have the tools they need. And literally, it like breaks down applications and supplements and all the fun things. So this is actually like an entire guide on working out, and it tells you why you should work out and like what to be careful of and what to be cautious of. And there's a thing about heart rate, and like this is how you know, this is what's exertion and this is what's not exertion and how you know. So I think that's super cool. And then if I can like flip pages, so there's a whole bunch of exercises you can do depending on where you are in your thingamajigs. And I think that's awesome. So another thing is the pre-op dietary guidelines, which is that supervised program that I freaking hated. But it breaks down like protein supplements and the carbohydrates in them to make sure that we stuck to our limit. For my provider, they were basically looking for was shakes had to be between 150 and 200 calories. They had to have 15 net carbs or less. And they had to have 15 grams of protein or more. So if it had that, you could. So they also give example recipes. I actually think the huckleberry one's really funny because, like, I live in the Pacific Northwest, but I don't even know where you can get huckleberries. So I guess somebody around here can. I can't. And then talk about all of the things that you're going to get. And they outline, like, the nausea patch I talked about. And also I had a bunch of blood thinners. I forgot to mention that. I had a blood thinner before surgery. And then I had injections every day. So the 2 days after surgery that I was in the hospital, I had blood thinners too. And then, like, all the things they'll do to keep you comfortable. And then what your days look like after surgery. And so it's all the things. So this is actually my surgeon's dietary plan. It breaks it down for bands and sleeves and stuff. My surgeon does bands like 3% of the time. They don't really do them anymore, but it's in the binder anyways. So this is what my surgeon's timeline looks like. Right now I'm in the last week of pureed foods. We're basically going into January 11th. So I will be cleared for soft foods on January 17th, and I'm super excited. I actually have a date set up to go have sashimi for the first time since surgery because I'm super pumped. So it outlines all the things we can have. Again, this is my surgeon and my practice recommendation. This is basically what I'm on now. So yeah, my 1 month post-op anniversary is on the 12th, so it's on Friday. So I will have basically a week of pureed diet after that. So this is just what we can do. And let me grab this. I'm really bad at this. I promise I'll get better. So this is what we got for right after surgery to just kind of outline like what we can do. And then I also got this when I checked into the hospital that just had a lot of information about the hospital itself and maps and stuff my family could use to be comfortable while they were there. And the nurses were super nice to my mom. Like, I have a great mom and she's awesome, but she was also scared for her kid who'd had this huge surgery, and they were really nice to her. And no matter what she asked for or what she questioned or whatever, they were just really polite. So I appreciate that. I'm trying to think if there's anything else in here that's relevant. Oh, so soft foods. I'll show you that real quick. So this is soft foods. And basically, like, the way the dietitian explained it to me is if it's not dry or tough, like, you can have it, or at least you can try. So I always thought that full foods was when I was basically, like, released to the wild. Soft foods is kind of already it. So I'm actually really excited for soft foods because I kind of miss food. So yeah, this is my super awesome binder. And talks about also, dietary choices, intolerance, nausea, constipation, exercise restrictions, just stuff like that, like what you can have for the different steps. So constipation is a big thing with bariatric patients, especially once you're recovering from surgery, because you have a crap ton of painkillers in you and you're not really getting a lot of fluid, and it's just really hard on your body. So what I really like is they actually give you a breakdown of what you should do. So, like, do step 1. If that doesn't work, do step 2. If that doesn't work, do step 3. Like, they don't ever say, oh, go straight to the hospital, or, oh, you should have fleets. And I appreciate that. They also do breakdowns of vitamins. Yep. So they break it down, and they give you recommendations on what brands you should take, and probiotics and stuff like that. So I had a vitamin deficiency way before surgery. I've been severely vitamin D deficient for many years. I have a doctor who thinks that my body just doesn't synthesize it or process it properly. So I've been on a pretty high dose of D3 normally. I'm actually, like, the dose that they recommend for bariatric patients is lower than the dose that I used to take. One of the things I'm doing is I'm actually going to wait until my lab values in my 3-month appointment to border that or change that. I think it's probably going to come out and say that I'm vitamin D deficient and I'll have to raise my levels, but I don't want to raise my levels without knowing that I'm still deficient. I'm assuming I will be because I just had surgery that made people deficient, but I'd rather wait for my labs. So vitamin D3 is actually a fat soluble vitamin, so it'll take a few months before there's like an issue. So yeah, I'm just gonna wait. Okay, so that is my binder and my surgery recap. I hope it's been helpful and not too crazy long. And holy crap, I can't hold an iPad to save my life. In my defense, it's like midnight, so that's what I'm going with. But yeah, if you guys have any other questions or there's something that you were wondering that I didn't touch on, definitely let me know and I will try to at least respond to it in the comments. But I hope that's helped. Everybody's experience is going to be really different. And especially with the RNY, like it's kind of the same surgery, but it's kind of not. Ages are going to be different, places around the country, surgeons, practices, so on and so forth. Like I said, I have two friends who had the sleeve with the same surgeon I did at the same practice I did. One was almost 2 years ago and the other one was almost a year ago. And I'm sure we all have different experiences. So the best thing I would recommend is definitely speak with people in your area or even with your surgeon or their nurse practitioner or whatever to give you more information. But I'm always happy to help. Have a good one. Bye.